Good evening, everyone, and thank you for joining us for another episode of Advocacy. Tonight we have a very good subject. I mean, of course, we have great subjects every Thursday, but here's another episode. I don't think we've ever talked about this subject, and I'm happy to have Jennifer and Damien with us so that we can dive into this because I'm ready to learn. I know Crystal's ready to learn. We're very excited to learn about sickle cell anemia. With that being said, my name is Paula Armstrong. I grew up in the DMV. I currently live in Maryland. I have two children. My son Jeremy is 24, and my Morgan Pop, those that always hear, my Morgan Pop is 20, and she has multiple disabilities. Crystal?
My name is Crystal. I'm located in Michigan. I'm married with 5 children, and some of them have disabilities.
Okay. So with that being said, we'll turn it over to Jennifer and Damien, who can talk to us and just tell us a little bit about themselves, give us a brief description of you and your family.
Yeah, absolutely. So I am Jennifer Lloyd. I am originally from DC, born and raised. We are a blended family and of three. We have 3 children. I work in this area, pretty much grew up in this area, went to school in this area, college in this area. So I'm, pretty much all things DC, Maryland, Virginia for the most part.
And I'm Damien, and like Jennifer said, we have 3 beautiful kids. I'm born and raised in DC as well, Southeast DC. Cowboys fan.
Oh,
We're gonna stop that, Damien. We ain't gonna go there.
That's the DC stand for Dallas Cowboys, but I am a firefighter. Been a firefighter for 17 plus years, and we are also real estate investors. And yeah.
Well, before we get started, I want to thank you as a first responder. I want to thank you for coming to our rescue, being a first responder. Kudos to you. Now, Dallas, we're not gonna go on that. I'm gonna also give you guys kudos because we're all on here. We're Southeast. Everybody Southeast.
Well, she's uptown.
I lived in Southeast, but mostly uptown.
Well, you've had a touch of Southeast, so we'll just bring you on in. Okay, so as I stated at the beginning, we're talking about sickle cell anemia. I will say I've always heard about it. I've watched shows about it, but I've never really talked to a family firsthand that has dealt with this. And so I'm excited for you all to just tell us about your experience, give us a little history of your family as far as that, and then we'll go from there.
Okay, man, where do we get started? It's a lot. So as I said before, we are a blended family. So our oldest daughter, who is 18, she currently has sickle cell SS. There are variations of sickle cell anemia. There's SS, there's SC. SS is one of the most chronic forms of sickle cell. And then the youngest child, the baby boy of the family, he also has sickle cell SS as well. And so they, of course, were diagnosed at birth. And so, trying to figure out how to manage it because I had no prior experience with it. I didn't even know that I had the trait. So sickle cell is one of those disorders where it is hereditary, and it is you get it from both parents, and that's most commonly how people really don't understand or don't know. Well, how do you get sickle cell? Where does it come from? I am a trait carrier. Their father actually had the sickle cell anemia himself, and he actually succumbed to complications from sickle cell back in 2014. And so, learning how to manage a child with sickle cell was new for the both of us. I mean, it's still new, pretty much, new. We're kind of coming through it. the journey with the kids as well, right? We're trying to figuring everything out. And so when Kendall, I say Kendall, so Kendall's my oldest, she was diagnosed when she was born. And it was learning how to navigate, with this child. So I was a new mom. So there was also a learning curve for me then as well, right? And then you layer on sickle cell with that. So all of these other medical providers and specialists that are now in the picture, and I'm trying to figure out, well, who do I talk to? Who do I go to for advice, medical advice, when this is happening or that's happening? And so it was difficult. It was really difficult with, just trying to manage her health growing up. One of the things that we ended up having to do was get a specialist. So they have a hematologist. And so they see their hematologist every 3 months. I wasn't used to, having to find a hematologist and take her in. And then because it's a blood disorder or blood condition, they have to be poked, right? They have to have shots or get shots or blood draws every time they go. So that was really difficult because they oftentimes couldn't find their veins, right? As a baby, as a toddler, growing up. So there was a time where I think Kendall, she had to be poked like 9 times in order for us to get that one blood draw. And this particular time she had what's called acute chest syndrome. And so acute chest in children with sickle cell can be pretty common. It is an infiltrate of the lungs. So when they have a cold or a bad virus or the flu, sometimes that can turn into pneumonia pretty quickly. Oh, wow. So, whenever there was a temperature of, 101.5, typically that's what the nurse would tell me. Then it was immediately, we got to get to the ER because we just don't know what's happening inside their body. Because they already have a compromised immune system with sickle cell, right? They already have a compromised immune system. Any sort of like blood infection or, anything like that could be detrimental to them very quickly. So we had that to think about, of course, as they were coming up and just getting them to the hospital on a regular basis whenever they were sick. And kids carry all kinds of wild germs.
That's right.
Yes. And so, they were in daycare, coming home with the daycare germs and the colds and, all kinds of stuff. So we had regular nurses that we saw whenever they needed to go to the hospital. And so just going through that journey when they were like really small, they were hospitalized quite a bit. I would say my oldest she was hospitalized more than our son. Yeah. He fares pretty well in terms
How old is your son? How old is your son?
He just turned 14 this month on the last month on the 28th.
Yeah.
Okay. So you have 2, one is 18 and one is 14 with the sickle cell, right?
Mm-hmm.
Yes.
Okay.
Yeah. So he's funny enough, he's the most rambunctious, he's the more active one. And so you would think, because oftentimes, their sickle cell, because it's I call it a silent disease or a silent disorder, because you can look at a person and you just never know, right? You don't know. And even going to the hospital, if you aren't followed by a particular doctor or hospital and you come into the hospital complaining of pain because, sickle cell, and maybe I should back up and kind of explain a little bit. Sickle cell disease or sickle cell anemia is basically the sickling of the blood cells. So our blood cells, normal people blood cells, are
round or oval type shape.
Oval shape, squishy, flexible, maneuverable through our veins, through our system, right? However, sickle cell patients, their blood cells, first of all, they die quickly. They die more quickly than us normal folks. But then they're crescent shaped, right? So think of a banana, for example. And they're very hard. And so that trying to flow through their blood veins or through their veins, oftentimes it gets stuck. It starts to back up. It starts to back up the rest of the blood cells. And so now there's no blood, there's no oxygen circulating, to a particular part of the limb or even a particular part of the organ. And so this becomes a problem because the lack of blood circulation, to those limbs, to those organs, it causes deterioration. And so their organs and their bodies and stuff start to deteriorate faster because of those pain crises, the sickling of those blood cells. When they get backed up, it causes pain.
Welcome to your NFL headlines of the day.
Alexa, stop.
Sorry, Alexa's on. But it causes pain, right? And so imagine walking into an ER or an urgent care, in agonizing pain, telling them I need pain meds or I need stronger pain meds. Automatically they assume, okay, are you a drug addict? Are you just looking for the next high? They're trying to evaluate, whether or not you are telling the truth, whether or not you're real, whether or not the situation is real. And of course, the longer that evaluation takes, the longer this person is sit in agonizing pain.
Oh, wow.
So it becomes very important for, people with sickle cell, disease, sickle cell anemia to make sure they have a hematologist, make sure they are followed by a specialist, primary care doctor as well, right? You want to make sure you're followed because you want to be able to go to a hospital or go somewhere where you're going to be treated promptly and not questioned. Not questioned and not have it be delayed because you're in pain and you're looking for some comfort. And so, to get back to the organs and, being treated, oftentimes too with, sickle cell patients, the other concern is for children specifically is stroke. For stroke. And so my daughter, our oldest, actually had a stroke, what's called a transient ischemic attack. She had a stroke at the age of 8. And this is one of the things that they go to the doctor when they go to their routine 3-month appointments. They also have a yearly appointment where they get a CAT scan of the brain. Or is it? It's not a CAT scan. It is a
CT scan. Is it a CT
scan? Yes.
Okay.
Yeah. So it's kind of like an ultrasound of the brain, and what that does is it's measuring the blood velocity in the brain. Is it too high? Is it too low? Essentially, to tell the doctors that this person or this child is at high risk for stroke. We need to do something a little different. The particular time that she ended up having a stroke, we were there having my son checked out because he was previously hospitalized with acute chest. So we were there for a follow-up with him to have him make sure he was good to go. And then she came down with a fever. So she ended up with a fever, and the fever was about 105. So fortunately, we were in the hospital already, getting him, checked out from his hematologist, and so they told us to go immediately to the ER. So we go to the ER. We get into a room, and on the bed, shortly after the nurse came in, she ended up having a stroke, and so she's just like, "Mommy, I can't move my right arm." So I was like, "What do you mean? I can't move my right." So I can't move my right arm. I can't move my leg. I can't move my feet. And then I could see her face started to droop a little bit. She was slurring in her speech. And then she got to, she couldn't recognize a pen, like an actual ink pen, a writing pen. Couldn't recognize a pair of scissors. So I'm freaking out, I'm calling the nurse. I'm ringing all kinds of alarms to get people in there. And, they came in and they evaluated her. And, about a half an hour to 40 minutes later, she started to regain movement in her feet. So she started to regain movement in her feet, and slowly, that kind of worked its way up her leg and her arm. We ended up in ICU anyway, because they weren't sure of her condition. By the grace of God, she regained full mobility. Full mobility, speech came back. They monitored her all through the night, monitored, her brain, heart, everything all through the night. And so I want to say probably about a day or so. She was out of ICU and into a regular room. And so we were grateful, that was a pretty traumatic experience. She doesn't remember,
sometimes that's a good thing. Yeah. Well, I do want to go back, and I do want to ask about, I know you started off by saying there are different types of sickle cell anemia. I've never heard of this, and I'm sorry. As you were talking, so many things was going through my mind to ask, but I'm going to just trickle them out because I know Crystal has some questions too. But one of the things I would love for you to educate me with in our audience is the difference between SS and SC. Do you know the difference between the two? I know you said the SS is more of the one that comes with more illnesses. Can you just give us the definitions or a description of them?
I wish I could.
Oh, okay.
I wish I could. I don't have the medical name
for
SS and SC, but I do know that SS is one of the most chronic, and I do know there's a third one also. I believe there's a third one also.
Now, are you categorized with one if, like, I know you said you're a courier. If you are a courier, are you categorized as one of those? Because I know some people may be a carrier, and they may be say, okay. So what is the courier considered as?
Just that. So I myself, I didn't even know. I did not even know. Yeah, I had no idea until I was pregnant with her. And so I think my mom knew, but because it never really adversely affected us or affected our family.
No homework done on it.
Yeah. She was just kind of, out of sight, out of mind kind of, thing. Right. And oftentimes too, the older generation really didn't know much either. So I got educated once I found out that I was actually a trait carrier. And it's kind of crazy because I don't know if I honestly don't know if I would have done anything different, because I knew that their dad had the actual disorder. And I watched him go through different, issues. Hospitalizations, managing his health. I watched that, right?
Well, he had full blown sickle cell then.
Yeah. So there is and I forget the percentage, and we can certainly, Google it and find, but there's a percentage of, if you have one carrier, one parent is a carrier, the other parent is a carrier, the likelihood of your children or your child actually having it. And then there's a percentage of if you have a carrier versus someone with the actual full-blown disorder. And what the likelihood of your child or your children, actually having it also. So there, it varies, but it also varies too. Again, was he SC? Was he SS? So I'm not a medical expert at all.
You become one after you go through with your kids. It's like as you go through, you have to, like you say, you have to do your research and you have to become somewhat of an expert in those areas. You do. It's just
Yeah.
inevitable, you know.
Yeah.
Yeah, wow. I just it's funny because my son, when he went to school, he was getting ready to play football and they had to get, they had to ask him, do they have sickle cell? And he said, Mom, do I have it? I said, I don't know. And I say that to say, like you said, most people
Yeah.
have never been tested. And if I'm correct, it hits the African American community. Is that
Yeah.
correct?
It
Yes.
does.
Okay.
Well, people of color, honestly,
Yes. Okay.
it's more prone, of course, in
Mhm.
African culture,
Mhm.
African American,
Mhm.
culture, but it can also be, Indian culture. It could be
Mhm.
Spanish culture. It's just, it's people of color.
Okay. I didn't know that, but I say that because I never thought about it because some people, when we back in the day, when you got with somebody, you just love them. And most people
Mhm.
never ever considered getting tested.
Hmm.
And it's amazing, like you said, because some people had kids and they didn't know either one of them were carriers. And once
Mhm.
Right.
they had a child and their child developed the full blown sickle cell anemia, that's when they got tested and realized the whole time that they were carriers. So I think, and I don't know if back in the day people got tested or if that was, I know when they run blood tests, I don't know if that's in there. From my
Something.
understanding, it's not. But it's something I think, is that something they should include? I know I've heard people say that that's
I
something.
thought they used to do that.
I
Like,
do too,
there was
Crystal.
a time when people were getting ready to be married, they took blood tests. I
Mhm.
don't know if that was like a requirement or something.
Yeah.
And so people
Yeah.
kind of knew what they were getting into. I don't know how long ago this was, but I used to hear that kind of like my grandparents' generation or
Mhm.
something. But also, you also have to understand like what communities do they come from and their access to healthcare like that to do something like that, because also, especially in the African American community, I'm right along with Jennifer. A lot of times we just did not know until, you're going to see the doctor preparing to have your baby and your blood is drawn and you probably find out information about yourself that, you did not know.
Yeah.
So this is definitely information
Mhm.
that is helpful to a lot of us. You know, I found out one of my kids is a carrier of, hope I say it right, thalassemia.
Mm.
Mhm.
And so I was like, well, what that mean? So I mean, you just don't know. And I was like, well, where
Mhm.
that come from? And who,
Yeah.
so I think that's just something that we don't always know, but the Lloyds here today are giving us something to consider as
Mhm.
people move along in life, as they consider life partners, things like that. And I think this is very, very helpful.
Yeah, because like you say, even if that's not something that you would change, it's something that you know.
Yeah.
And
Yes.
I will say, even for Morgan, my special needs daughter, one day we went to the doctor and they said her platelet count was low. They said, "Did you know her platelet counts was low?" And I think we found out this about when she was probably 7, 8, or 9 around that. And I said, "No, what does that mean?" Um, and they gave her something to bring her platelets all the way up, and then they said they'll test it in a couple of days. When they tested it, it was low again. Come to find out, she's a carrier of thrombocytis. um
Mhm.
I had never heard of it. It's a blood
Mhm.
disorder, and it's when her platelets are so low that if she hits her head or something happens, she could bleed to death.
Yeah.
Now, if she married somebody that had thrombocytis, they could potentially have a child with full blown thrombocytis. So,
Hmm.
Right.
again, these are things that you're learning. I had never heard of thrombocytis, never.
Yeah.
Yeah.
Yeah. And
But
then it's educating the kids,
yes, yes.
Absolutely. Like when I
Mhm.
found that information out, I always bring it up to that kid. Like, this is information you need to know. It's in your
That's right.
medical file when you're of age and you have access to your medical records and things. This is just information that moving forward. And I think if I can say this, like our generation is doing a better job of helping our children move forward in life with more knowledge about themselves. If I could say it also correctly, I think our generation probably did a little better with taking our children to the doctors more consistently, to a pediatrician and things, and we followed up on some things. So I think we're learning more, and then we're educating our children as they move forward in life. Like just having that knowledge sets them up a whole lot better.
Yeah. And that's the thing, like we have more access to more stuff than out the older parents, they had to deal with a whole bunch of stuff we don't have to deal with.
Absolutely right.
You're right. So it's like, when you know better, you do better. And then when you're in an environment to do better, you should definitely do better. And I know, like, even now, like I'm about to be 43 years old, and I still don't it's not like you get your blood work done. They're like running down everything that you could possibly have or don't have. Like they don't tell you. And you would assume if they don't tell you anything, you don't have anything.
That's right.
You're right.
So it's not like you're going in and saying, hey, can you look and see if I have X, Y, and Z? And then they come back and they tell you. So at what point, I guess something we can teach our kids and, future generations is to just do those particular tests to see if you have anything that's in your blood before marrying someone, just so you can know for yourself. And then the person that you're choosing to marry, so you do know down the line, if you have kids or anything like that. So it is educating yourself, even just to that point, and to know, that you don't have anything, or you could potentially have something that could be passed on to your child or something like that. But, typically you just go and run down stuff that you're going to catch, sexually or what have you, and you're like, all right, I'm good on that area, so the rest of the stuff doesn't even go into play. You don't even think about that stuff. But that is something, because who would know?
Who would know?
My mother never told me. Her mother never told her.
Yeah.
So
it's I think like you're saying too, and even with Crystal saying it, I think even being tested. I know when I was tested before I got married, I don't know what we were tested for. I know one of the things may have been HIV, I think, but when you really think about what we're tested for, do any of us know, even when we're going for the blood work? And I want to say, I don't believe, I do remember, this is my second marriage. I do remember my first marriage. I don't even know about my second one if we did blood work. I don't think we did. So even when people did blood work, what are we being tested for? And like you say, when I go do a physical, they call me with only the concerns. Everything else, they're like, yeah, don't worry about it. But you're right. You really don't know when they're running the test for all of these things. And I do know for even my son with sickle cell, I don't ever remember him being tested when he was young. If they did my stuff for prenatal and all of this, I didn't even know what I was being tested for.
Yeah.
So again, it's amazing, because even for my daughter that had thrombocytis, am I a courier? Was my ex-husband a courier? Yeah. Who knows? So these are very, like you say, these are questions that I guess it's like, it would be nice to know, hey, sit down with that doctor and say, what am I being tested for?
Right.
And
saying, I would like to be tested for this. Like advocating for yourself when you go in. Usually you do your blood work, and they're testing for your cholesterol and stuff. But sometimes, as now we can be more intentional when we see our doctors. I would like to be tested for this, or even with our children when we're bringing them in, like I would like a genetic test done, or I would like this type of, this is helpful to me as a parent too. So I really appreciate this.
And I'm wondering too, if insurances even pay for stuff like that. That's things that insurances are so iffy now. They may say, hey, you got to pay out your pocket for that, because a lot of that they may not feel like it's necessary. But even for you to know, I think for me, that's worth paying for.
Well, I know that sickle cell is definitely tested now. So that conversation with my doctor, when I was pregnant with her, it was him saying, hey, did you know, he actually automatically ran it. Hey, did you know that you were a trait carrier? And I was like, what? No, that began the conversation and that whole sort of basically opening Pandora's box. Well, what does that mean for my child? Well, her dad or my husband at the time, well, what does that mean? Like he's, he has this. So if I'm this, then what does that mean for our kid? And so we went through this whole line of questioning. Of course, I'm freaking out in my mind. I ended up being classified as a high-risk pregnancy just due to that fact. Of course, he went down, well, all of the scary things of this is what could happen. And, do you want to terminate the pregnancy and, so forth and so on, or do you want to do a amnio? Is it called amnio? Yeah. So I was just, I was like, no, no, we're going to continue to have faith and we're going to go through with the pregnancy and, it is what it's going to be.
Yeah.
So
one thing that I do hear is that, again, these are things that I've seen and heard. I don't know. Again, you clarify. One thing that I've heard is when they go through they're called crisis, right? They get, what helps them out is blood transfusions. Is that what happens?
Yeah. So typically, so when they're in crisis or have a pain crisis, we go through a whole series of trying to make them feel comfortable, right? So it's Tylenol. The kids have their doctors prescribe for them, Oxy, if necessary, but Motrin, heating pads. And so we do all these things to make them feel comfortable because, again, this is pain. And we're talking about pain bone deep, right? The massaging of the muscles or the tissues, that's not really going to help them, although it might give them some comfort, but the pain is still there for them. And if those home sort of remedies or treatments don't work, then we go to the hospital for the stronger stuff. And that's where I'm like, if you are not regularly followed by someone coming into the hospital saying you're in crisis or you have a pain crisis, they don't know you from a can of paint. So you could be someone coming in that's just addicted to, the stronger mids and just looking for a particular high, And so, it's good to make sure that you're followed. But that's when we go in, we see their doctors, and sometimes we could be treated as, inpatient from the clinic, and other times we have to go to the ER. But at the point for which she or he would actually need a blood transfusion is going to depend on not just the fact that they're in crisis, but whether or not their hemoglobin levels are, high or low, right? So everybody goes in, you sort of have a baseline of where your hemoglobin level is in terms of your, with your blood. If those levels are dropped or have dropped and are dramatically low for someone, with sickle cell, then you're going to need a blood transfusion. And that's the way that, a part of, one of the treatments for them when they go into the hospital. Now, earlier on, when my daughter was really young, when she had to have blood transfusions, they would make her stay, and it was an automatic hospital stay, at least 24 to 48 hours. So you can imagine medical bills were hefty. So now, fast forward, our son had to go in. Was it earlier this year or was it earlier this year?
Well, maybe earlier this year.
Yeah, but he had to go in.
Matter of fact, it was the end of last year.
Okay, wasn't doing well. He had I don't know 3 or 4 different viruses: the flu, the rhino, and some other stuff. I don't know, but it affected his blood level and it dropped dramatically, and so he had to be transfused at that time. But they watched him for over a course of a couple hours and saw that he was doing well, and they let him go. So I think their policies or their processes, the way that they triage, the sickle cell patients, have been evolving. But yeah, earlier on, if you did a transfusion, it was an automatic hospital stay for at least 24 to 48 hours. And you had to have no fever and, it had to be good to go.
So
Now with the
I know they live somewhat of a restricted life. Can you give us what that looks like? Because I know some people can't do sports and they can't.
yeah, that's what my question was. Like,
okay, good.
Like, as parents, what is like some of the things that they can do? How does it affect their academics or their school life? Like, I would like to know.
So I would say there's really not any restrictions in regards to like you can't do this. Um, like my son, he wants to, my both of them played sports growing up, played basketball. My son wants to play football and stuff. And I don't know professionally if you could play football because you have it, but I know like it limits their like he's not really
He gets
winded, yeah, easily. So it might affect them where he can't actually go as hard as every other kid may be able to because of that. But we don't like have any like you can't do it because you have sickle cell.
Right.
So we'll allow them to do, and then you know your body if you're tired or whatever, catch your breath. Of course, we want you to push yourself because some of it you could just be winded because you're out of shape too. But it is that fine line of pushing yourself, but also knowing that you do have a little hindrance, and this is why you can't go as hard as the other kids too. So
yeah, Kendall, when she played, she did try out. She did do basketball for one season too, and it was visible. We could see visibly that the other kids, their energy, their oxygen, and when they were going, but she got pretty gassed out. She got gassed out quickly. And so for Dylan, who's our son, it's pretty much the same for him. The other thing too, when you talk about restriction, when they overexert themselves, right? So they are playing a sport or doing some kind of activity. I don't know, jumping down a flight of stairs. Who knows, right? Especially with the boy, because that one. But when they are overexerting themselves, it could trigger a pain crisis. It could trigger a pain crisis in their knees or even in their ankles or feet or in their back. For my daughter, it usually begins in her back. And then temperature. So when you talk about sports and temperatures, the varying temperatures play a role too, and them having a pain crisis. Usually they're in situations where they're super cold, then yeah, it's automatic. For my Kendall, it'll start in her back and it'll kind of start to spread, from there. But so we have things in place in school for them, like a 504 plan. When Kendall was in school, she had a 504 plan. Now she's in college. She also has she sees the disabilities office. So she has accommodations in college for her so that if she needs them, then she can take advantage of that because of her situation. For Dylan, one of those accommodations is extreme temperatures. Like, they have fire drills, and it's 30 degrees outside. He needs to have a coat. He can't walk outside, like everybody else. Or if it's AC in the classroom, he can't be sitting under a vent because, automatically if he's sitting there for too long, that's going to start to trigger a pain crisis for him.
You don't even think about some of this stuff. I mean, when you think about it, I guess it's like really taking a look at everything that they could be affected by. I mean, when it's cold outside, like, can it go outside and play in the snow? Things that kids do. You never even think about stuff like that.
And that's why I say they do that. They, even though they always complaining that they cold all the time, they want to be out when there's a blizzard out there. They want to be out there. So we let them go out there. We let them go out there. So we don't. That's what I said.
So we wrap them up. We make sure they are, layered up and they can't stay out there for too long. But we try to give them or allow them to have as much of a normal, childhood. As much as their bodies will allow them to. Mm-hmm. And then it's teaching them to be aware, to be aware. Okay, this is hurting for you, or you're tired. I think you need to take a break, or, this is what's happening to your body. And that's where I feel like, the older generation, may have not done so well of a job. And that's just making sure that child is equipped, aware, and he or she is knowledgeable about what is happening with their body and with their condition.
Thank you for saying that, because I think that was my next question. Like, how have you educated them so that they know? Even though sometimes families may have kids they're raising and there may be a condition, they're taking really good care of that kid. But it doesn't necessarily mean that kid knows what to do or how to care for themselves. And then these kids become adults, and you have a college student now, and she's away. She's out of the area. She's out of the state, if I can say that, right? And so she would have to know how her body responds to things, because, let's just say, y'all go out there and play in that snow, and they go play and they come back and they're feeling pain. People not taking the time to say, how that makes you feel? You got to be aware of this. So that. Now you got to remember that if you want to take that chance tomorrow and go back in the snow. And so this is like that, making sure we help them along the way of knowing what they're dealing with. In some instances, it's a little hard. And I'm just saying that because I have a kid with ADHD. And he's like, I know everything about ADHD. I'm like, you don't, son. Let's learn more, because you'll be an adult with ADHD. And let's learn how some good skills that we can do and tools and things, I just want to prepare you, as you keep moving along in life. And so I love that you brought that up, because that was my question, Jennifer. Like, your daughter's away and your son may very well follow a path of like, hey, I want to move across the US. And you as parents want to know, oh Lord, can they make it? You know what I mean? Like,
and being an advocate for yourself almost. And accountable for your choices. And because what I'm hearing is accountability. Like, you want to play in that snow, man, you already know what's coming along with that.
Yeah, absolutely. So on the accountability part, so my son, he is the one that pushes the limit, right?
That's a boy for you.
It's always one.
He's the one that pushes the limit. So he's like, I'm going to be out here in this snow for as long as I'm going to be out here. So I go out.
Like, you only live once.
I go out and I check. He's like, oh, my fingers are numb. I can't feel my fingers. I'm like, your fingers are numb. So when did your fingers become numb? Like, let's walk through this, right? But it's allowing him sometimes, and it is a hard lesson, but sometimes you're gotta be allowed to feel those consequences so that your brain starts to make the connection with your decisions. What you decided, now my body's hurting, so I need you to start making some of these connections. But in terms of education, so because they have been going to a hematologist since they were born, I have made sure for the most part that they continue with their every 3-month checkups, but that they're also a part of like I have joined some of the sickle cell groups with the hospital. So Children's National Medical Hospital, something like that.
Mhm.
But in DC is who they're followed by. And so I joined the clinic. I talk with a lot of the counselor or social workers for the sickle cell department. We've actually gone and spoken at George Washington University. They have a class, or annually they have this partnership where students who are, I guess, either studying this particular field, they'll have some of the parents come out and actually sit and do like a panel and allow them to ask questions, very similar here. So we've actually been able to go and sit and do that with the George Washington University group. And but it's making sure I make sure that they're aware. I make sure that they're knowledgeable. I make sure that they've had books since they were younger talking about what sickle cell is, how it affects their bodies. And even, when they go to school, some of their friends, know that they are, sickle cell patients. For example, Kendall's roommate, and I thank God that her roommate is attentive and caring enough, because she'll tell her, hey, have you taken your medicine today? Or you're not feeling well, or this and that's been going on for 3 days, Kendall. I think you need to call your mom, or I think you need to call, home and just kind of let folks know what's going on. But I make sure that they're knowledgeable about what's going on with their body and their condition.
Well, one thing I do want to bring up too is, and I know I've seen on 60 Minutes, I love my 60 Minutes, but one thing I've seen on 60 Minutes is this breakthrough cure. They say it's a cure for sickle cell. And they had this patient that they've been following for some time. And I mean, she couldn't jog, she couldn't exercise, she couldn't do anything. And I know maybe like 2 years ago they started doing, they were testing her for it. I think it was longer than that, but they're basically saying now that they have a cure, something because when they followed her, they said that she had begun to be able to do these things. She hadn't had any crisis. And they I don't know if they classified it as a per se cure, but I do know that they said that she's able to do a lot of the things that she's not been able to do. And all the time that she's been taking, I don't know what it was, but it was a 1 or 2 time thing. But they kept her in the hospital. And at this point, I think when they were going through it, if I remember correctly, I was thinking it was a process of getting rid of all of the the cells.
Yeah.
They were pushing them out of her body. And I mean, when they showed her, she was in so much pain, but they were like, it's the what is it? The light before the whatever it is, the light before the storm or whatever. But basically they were getting rid of all the sickle cells out of her body. And this process was replacing it with the regular cells. And when I tell you they have been following her, and after years, she still had not had any crisis. Have you guys heard of anything like that came in the presence of a cure?
Yeah. So we have been well, first of all, I guess I'll say there are a couple treatments out there. I think it's stem cell and bone marrow transplants.
I think it was that.
Yeah. So that is a process. It definitely is a process. When you think about people who are transplants or have, different types of transplants, like they have to go through a process in the hospital that completely isolates them, because this process breaks down their immune system so much that we can't afford for you to get sick or for you to be any kind of contaminated, right? So they usually isolate them and they put them in the hospital, and they're in the hospital for quite a while they're going through this process. But that was not, I won't say offered to us, because there are children who are like super severe, right? When it comes to the restrictions and can't do certain things, constantly in pain, needing blood transfusions like every week, every other week, or how our kids are not at that point.
Okay.
you know,
I was just gonna say, so it's like she mentioned, because that cure or that remedy is so severe, it's like, do you want, like with our children, like they have a pretty much have a regular, life, you know what I mean? Like until they have a pain crisis, they're pretty much good. Like it's not happening like it's every single day. So those extreme situations where you kind of want to see if that will work is when you have one of those kids that's every single day pain crises. It's like, it's like six one way, half a dozen the other. Either you're going to be in pain every day because you just have the disease and you can't, get rid of it, or we're going to try to do something that's going to possibly help you, which is going to be probably as equally, if not a little bit more painful, but it may be a light at the end of the tunnel where, once the risk is worth the benefit. So with our kids and them not being that severe, it's like, do we want to put them through all of this for something that may work or may not work?
It's definitely been proven that it works and it is a cure. I remember years ago following a little boy who went through bone marrow transplant as well. Yeah, he went through a bone marrow transplant as well. And he was cured from it. He was absolutely cured from it. Even after, years going back for testing, they found no traces, no trait, of sickle cell in him. So it definitely is. But it's how evasive, is the procedure, right? And I definitely say that it is for, children when you are getting to that point, when you're, and I could be wrong too. Again, I am not a medical expert, but when you're getting to that point where you're facing life or death situations, right? With your organs failing, with needing blood transfusions, on a routine and regular basis, needing help with just managing, the pain, right? Then definitely you want to, because you want relief, you want to be able to live some sort of a normal life. And I would say for our kids, they live a pretty normal life, right? Relatively normal life. Like I said, Kendall, our oldest, she probably goes through this a little bit more, not a little bit, a lot more than our son, especially you start talking about, and I don't know if we can talk about this on here, but her cycle.
That's real.
Yeah.
Her cycle is every month without fail. Her cycle is going, and it's the hormones, of course, it's the blood flow. It's going to trigger a pain crisis for her. Sometimes that's one day, sometimes that's a couple days, sometimes it's just a few hours, and she's able to, manage her pain and, go on with the rest of the week. But sometimes, it could be, it could kind of take her down for a couple days, but that's an automatic trigger for her. When it comes to just sort of managing her pain and her health on a regular basis. I can't say that for my son, but in terms of needing an evasive procedure to help manage her normal life or her well-being or her pain throughout, the weeks or months, I don't think we're at that point.
Okay.
At that point.
That makes sense.
Also, if I can add, I think that would be not easier, for the child, of course, but an easier process when they're younger versus like now, where they have a lot more stuff going on, school, she's away in school and stuff like that. So having to really be isolated in the hospital to get these particular procedures, I think, I could be wrong, but as a little infant, baby, adolescent, where you don't have as much responsibility and stuff like that, that would be it would be more of a situation than, kind of like stopping your life now, going through the process. And
but it happens.
It depends on, of course, how, bad your situation is. But
it would be good if they could start that when they're babies. I mean, as soon as they, like you say, I mean, if they know that is an option right then and there before they even get used to being in pain, or
Right.
it would be
Exactly.
nice.
Yeah, but it won't happen as an infant, because as an infant you are still carrying what's called fetal hemoglobin, right? And oftentimes, just as a sidebar too, fetal hemoglobin, I actually saved my son's umbilical cord blood, because during that time, right, if he did not have from another sibling, we could transfuse or I think it was transfuse our daughter with fetal hemoglobin, with like her siblings umbilical cord blood, in an effort to, you know, cure her sickle cell. So as a baby, you carry fetal hemoglobin, right? So you're not gonna experience the pain, you're not gonna go through sort of those pain crises, and it's very rare that you're going to go through those difficulties as an infant, right? Now, when you get into your toddler years, that fetal hemoglobin starts to die off, and then you start to produce as a toddler that, you know, those sickle cells and the regular hemoglobin and blood cells that, you know, you're going to start developing as a youth, as an adolescent. And that's when you're going to start experiencing those pain crises. My daughter did not experience really pain crisis when she was 2 and 3 and 4 years old. It was the acute chest that had us in the hospital. So it was the colds or the flus that ended up developing into pneumonia because she didn't have a strong immune system. Those were the things that ended up putting her in the hospital. Those were the things that ended up sort of causing, you know, her hemoglobin levels and her blood levels to drop, which may, you know, in turn, of course, resulted in her having a transfusion. But it wasn't the pain. It wasn't pain at that.
Okay.
But as they start to get older, then you'll start to develop that.
Okay. Well, I have a question. I do, before we start closing out. As parents, Jennifer and Damien, how have you two coped with like the stress of managing, of caring for your kids, the hospitalizations, or just the pain at home? Even, you know, it might look different now because it's been some years, but even in the beginning, because we might have people listening and they may be really feeling the struggle here, and it would be helpful to know.
Ooh, child, you just opened up a whole can of
I want to just show my shirt.
Oh, come
I
on.
like that. I like that.
Yes, there is definitely a whole lot of praying, a whole lot of trusting and believing God to just really work this situation out, to ease pain,
Yes.
to heal, you know, completely, you know. There's a whole lot of trusting and believing, you know, God for that, for sure, you know, for us. And we establish that, and we try to establish that foundation in our kids too, you know, to pray. You know, when my daughter, when she's away, now that she's away and she's a little more independent, when she's telling me, you know, hey, you know, have I, you know, mommy, I had a pain, or I'm in pain all day and blah, blah, blah. You know, one of the first things I asked was, what, did you pray this morning, or did you pray? And so she'll tell me, yeah, you know, I prayed, and, you know, I talked with God, and then she'll tell me some of the things that she did to help get herself back, you know, back together. Right. For me, you know, when I hear it now, I'm a lot more calm than I would have been years ago when we first started off. When we first started off, it was traumatizing. Yeah, it was traumatizing, because you hear, when you go to the doctor, all the worst case scenarios. So trying to cope with that, you know, from then even all the way up until now, it certainly is me leaning on God. But I also, you know, I have girlfriends, you know, I had girlfriends then, you know, that would come and would allow me to go, and I have my little spa treatment here or there, or go and just try to relax. They'll come and watch the kids, and I can go and relax, or just kind of go and take a little bit of me time, do some me time, so that I can try to regain my strength.
Yes,
really regain my strength, because it takes a lot to manage. Getting them to the appointments, calling every day, even while she's away. Hey, have you taken your medicine today? They're on a daily medicine. I don't know if we talked about that.
No, we didn't.
With them having sickle cell, they are on a daily medicine called hydroxyurea, and that medicine helps to reduce the sickling. It helps to it helps their blood cells to last longer, to be more full, vibrant, healthier blood cells, and it reduces the amount of hospitalizations that they could possibly have, right? So they take that every single day, and for the rest of their lives, they are slotted to take this medication, and so I'm a lot calmer now than I was in the beginning. But I can totally see. It's just making sure you have a good support system.
Yes.
My mom, has been instrumental. She'll come in, step in, and help us, when we need some relief, or when we need some help, or if we just need to go away on a little vacation just to get our minds together, try to relax a little bit. But it's having a good support system. So our faith, our belief, and our trust in God,
yes,
and having a really strong support system around you, and then being a part of too the networks of other people or other groups for people caring for sickle cell patients, or even being a part of some of the doctor or hospital groups, for people with sickle cell. Being a part of those puts you in connection with other people, where you can ask questions and you can start to feel a little bit of relief with what it is you're going through.
Absolutely.
What about you, Damien? I saw that you pulled your shirt up and said, be still and know that I am God. But tell us some of the things that you do to get through this process.
I have been through a lot of tests and trials growing up in my life, and I could always depend on God. So because of my past relationships and walk, and him showing up time after time after time, I know that my life, my kids' lives, my family life, this world life is in his hands. So I do what the word says, to give it to him, because I can't do nothing with it. He says, worrying doesn't add anything to you. So I know that I can trust that he cares for my kids better than I do, and I know that ultimately whatever, his life is in their hands, and I rest on it. I rest on that. I find strength in knowing that God loves them. He wants them to be well, and the pain or whatever they may be going through at that moment is going to be temporary, and it's going to help to build the character and their relationship with him as well.
Yes.
Wow.
I love it.
Yeah. I love it too. And I know that we love to have the shows where we have the man on here, because a lot of the times we know how us women are. Women don't mind being in the trenches, but it's nothing like having that man there in the trenches with you. And I was just talking to my friend earlier, and I was just like, that's where God has the balance. He has it where we complement one another. We may be the warriors, and the man is just like Damien. I'm like, listen, I'm gonna go ahead and I'm gonna take it to God, but that's where we complement each other, because it can't be both of us in it like that. It has to be, where one of us may be the warriors, and most times it's the woman. We got to get to the point, like you said, Jennifer. And I mean, just like you, I mean, this hasn't been a cakewalk for sure. But if you had told me 20 years ago that I would be here, I'd have been like, no, and been sane. But where I am now, it's like you and Damien both said, after you've gone through enough things, you could either worry all night, forsake your sleep, forsake your mental, that mental side, or you could just trust God. And I always tell people, I hate to say I don't have nothing else to do but trust God. Yeah, I do have something else to do, but I choose not to. So my choice is that I will trust God, because I could lose my mind. There are people that took the other road. So I have options. Other options have been presented to me by the enemy, but I choose to trust God. So that's a choice. And I will say in closing, for me, I will say I've learned a lot. I appreciate you guys coming on here, because seriously, this is a subject that I was always curious about. And whenever I hear this is going to be on something, of course, 60 Minutes. I love 60 Minutes. I always feel like I want to hear more about it. I want to hear more, because what I try to do is build on my knowledge. But I think dealing with it firsthand is something that is totally different from reading it in a book or seeing it on TV. So I think, just like us as parents, we all have our walk in life. What I always say is, how do you choose to do that walk? And I was just listening to the word yesterday, because life, as my young people say, life be life, and life is hard. And yesterday I was at a very, very low point. I was so tired, just you being pulled in so many different ways. And when I get like this, me and my daughter get on the couch, and the only thing that calms her down is the word of God. So what I do is get somebody on the word, somebody that I know gonna preach some word. And that word came to me yesterday, and it just lines up with everything we're saying. He said, when you get tired, like you have that electric car, you go and charge it up. He said, you got to charge up. You got to plug in. He said, you got to recharge. And this was El DeCino Walters. His birthday is June the 9th, the same day as mine. And I looked at his of this year, and it was about charging up. And he said, during that time when your car is charging, guess what? You can't be, how you looking at the clock, like, well, how long is it going to take to charge? No, you know what you're doing while that car is charging? You're relaxing.
Yep.
You're relaxing, but at the same time, you're charging and you're plugging in to get what you need, so that you can get back on the battlefield.
Yeah.
And I see that. I just really, really appreciate your knowledge base. I appreciate how you guys handle your children, because you basically give them a foundation in life, a foundation in their medical. I love that. And that you hold them, most importantly, that you hold them accountable for their choices, and that you give them as much as they can get, so that they can be able to make educated decisions about their health. So I think that is so important. I learned a lot from you guys. I did. And I, even for the cure side, I was ready to just be like, what y'all gonna do? Because it's a cure out there. But I the way that you guys explained that, I never thought about it that way. I didn't. So I really appreciate you guys educating me on sickle cell anemia. This was very informative, and thank you. I appreciate it.
Thank you.
Crystal, I'll go to you.
Yeah. I really appreciate you joining us on this platform, sharing your journey. You're inspiring other families, whether they're dealing with sickle cell or not. It's just an inspiration to hear of another person's journey with their children. And then, I like to go to the root of it, because sometimes when we're talking about it, it sounds like they had it together. But no, you're letting us know, like, you know what? It was a bit traumatic. It was challenging. And we had our faith. I needed self-care. Those are real, because people do feel, when we have these platforms, we notice that a lot of our parents feel alone.
Yeah.
They feel like they don't have help, and they definitely don't always feel supported. And I love what you said, Jennifer, because Paula and I always kind of stress about networking, joining support groups in your area. Like you say, it could be through the hospital or something. Like, it is something to be with people that may be dealing with the same thing. I feel like they're also a wealth of resource. And sometimes they're like, did you try this? Or did you go here? Or okay, you be like, I didn't even know. It's no news announcements of everything that's out there. So a lot of stuff is word of mouth and in these types of groups, networking. So I appreciate you guys putting that out there. And I think, I hope parents received a lot of takeaways tonight. I know I did. And, I've been dealing with raising children, and I feel like I still learn from my children. I learn from their differences. And one of the things I started off with them by saying, so in our household, I have 5 children, and, I'm like, hold up, everybody up in here got special needs. So let's start dating. I do. I eliminated that. I did not want anyone to look at like this kid, this person is less than because they can't do what I do. So I was like, everybody got special needs. And that's a true statement. Everyone in my house has special needs that I and my husband accommodate to. It's personalized. And so with that, I also let them know you were fearfully and wonderfully made.
Yes.
God made you, and you guys touched on it. You, Damien, he knows you best. He created you. And, like you said, he like, I care for you, and I think I love you most, but he loves you most.
Yeah.
So I just think that, just putting that out there, that's helpful to children as they're coming up so they can have those strong, firm foundations as they move on in life. So you guys just dropped some really good gems tonight. Even in telling your story, even if you said, well, I didn't mention this, I didn't mention that, you mentioned stuff that we have takeaways from. That's really helpful in our journeys with our children and caregivers, people who are just caring for other loved ones. A lot of people don't know where to start. And I think this is a great way to start, looking at them, recognizing, educating them, helping them be accountable. This was beautiful. This was so beautiful.
Thank you guys for bringing awareness to sickle cell. I can't tell you how many people we talk to that even mentioning sickle cell, they get, how you see people with the clouds with the question marks, like they get those clouds with the question marks because they just don't have an understanding or a really good understanding of what it is, of what it means, of how it even affects people or children or adults. They just don't know. And so September is actually Sickle Cell Awareness Month. And it is certainly something that, is near and dear to me, just to try to bring awareness to the masses about what sickle cell is. So I appreciate you guys for choosing this topic and deeming it necessary to talk about and to be able to share with other people.
Yes.
Damien, you gonna close us out. Give us some words of wisdom. We always gotta let the man close us out. Come on and close us out, Damien.
Close you out in prayer.
Not with no Dallas Cowboy stuff. I'm already telling you.
No, I just echo what my wife says, and it need not even just sickle cells. I'm sure you guys talk about a numerous of different topics. Just bring awareness and having a platform where we can come together and just realize that, like you said, life be life and for everyone. We're all going through something, and the closer that we get to God, the more that we lean on Him, depend on Him, and come together and help one another, we can get through anything. So it's just important just for us to just love on each other, to be each other's support system and accountability, and just do life together, as God intended for it to be.
Yeah.
I want to say you remind me of somebody. And Crystal, I don't know if you know this. He reminds me of my nephew, Devin.
Yes.
Doesn't he remind you of Devin? Even the way his personality.
Just his coolness, calmness.
That's my nephew, Devin. He going to love to hear that on here. And I also want to say, of course, we were recommended by Bunny Smith, our other co-host that's on here. We just want to report that her mom passed away, which is why she's not on the show. So we are sending our love and our prayers and our hugs to you, Bunny. We love you. We love your family, your mom. And I tell her all the time, your mom was so loved. But she was ready to see Jesus. And I just say, I just say, we miss her presence on here. but we definitely are sending prayers your way, Bunny. So we miss her though. We definitely miss her. She wanted to be on here, but again, just have a lot going on with her family, trying to get ready for her mom's homegoing service. So I just want to send love out to Bunny. And I just again want to say thank you guys. I mean, and we're in the area. I want to, at least around Christmas time, I would love to meet you guys, because you guys are somebody I could see us just jailing with. Yeah, just love
cowboy stuff, except for this.
I don't know that my husband is Ravens, so I don't know about that, but we can't talk about football. But we definitely, I would love to meet you guys in person, because I'm going through this life, like you said, one thing you want to do is meet some good people, people that, it doesn't have to be my daughter have sickle cell, but she's definitely, just your energy and the love and your outlook on life is just so awesome. Yeah. So I definitely would love, we're in the area. We got to get together.
Let's do it. Let's do
it. Let's do it for sure. But y'all, thank you so much again for coming on here, educating us. I'm sure we're going to have questions. So I don't know if you guys have social. Do you have a Facebook page?
We do, yes.
Good, because what I want you guys to do is we're going to have so many questions. And I know, and if you could take a look on Advocacy's page, if you haven't liked it, I need y'all to go on there and like Advocacy. More importantly, I need y'all to stay on and answer some of the questions that's going to come forward. Okay. All right, guys. Well, you all have a great weekend. Have a good evening. And again, this is just the beginning of our relationship. I can tell you.
All right. Thank you.
All right, y'all have a good evening.
Have a good one.